Tuberous Sclerosis Complex is a rare genetic condition that causes benign tumours to grow in various organs of the body. It commonly causes seizures, cognitive impairment, heart issues, and specific skin changes. Let's walk through its pathophys, clinical features, and a mnemonic to help you remember everything. It's inherited in an autosomal dominant fashion due to mutations in tumor suppressor genes like TSC1, which encodes for the harmatin protein, and the TSC2 gene, which encodes for the tuberin protein. These two proteins bind together to regulate cell growth, which is why mutations causing tuberous sclerosis results in benign tumors. There are three important skin features which are telltale signs of tuberous sclerosis. Facial angiofibromas, which are also known as adenoma sebaceum, are benign tumors of connective tissues and blood vessels that have acne-like appearance over the nose and cheeks. Ash leaf spots are hypopigmented, light-colored flat macules on the trunk and extremities. Finally, chagrin patches are raised papules in the lumbosacral region with an orange peel appearance. The most common presenting symptom of this disorder, recurrent seizures, occurs in about 90% of patients. This usually manifests in childhood in the form of infantile spasms. Other neurological complications are also really common. Brain tumors, particularly giant cell astrocytomas, can cause obstruction of the cerebrospinal fluid pathway. Moreover, autism spectrum disorder is seen in about 25% of patients with tuberous sclerosis. Cardiac rhabdomyomas occur in 50% of patients. Rhabdo means rod-shaped, and myoma means muscle tumor. So cardiac rhabdomyomas are tumors of the striated kind of rod-shaped muscles in the heart. These are usually picked up in infancy using an ultrasound, and symptoms like arrhythmias are usually pretty rare. Renal complications occur from lesions in the form of angiomyolipomas. These may increase in size over time and can cause pain and hemorrhage in adulthood. Renal cysts are less common, but they can also cause renal failure and hypertension. Now, this is a really rare condition, so I have to use a really basic mnemonic just to remember some of the most important complications. My mnemonic is really simple. It's remember tuberous sclerosis complex. RTSC helps me remember it can cause renal complications, specifically angiomyolipomas and cysts. 3 skin changes including angiofibromas, ash leaf spots, and chagrin patches. It causes S for seizures and cardiac rhabdomyomas. Thanks so much for watching Townsend Teachings. Don't forget to like, comment, subscribe, and please hit the notification bell. It really helps the channel. Bye!